So today we are going to discuss about the cardiac markers, the definition of the cardiac markers, what are the types of the cardiac markers, the features of the cardiac markers, um, and the kinetic activity of the cardiac markers. So we're going to discuss the absolute basics about the cardiac markers. So let's get started. So cardiac markers. What is a cardiac marker? These are intracellular enzymes and proteins that are released from the cardiac cells following damage of the cardiac cells, and they are released into the bloodstream. Okay, and show an initial rise in their concentration in the plasma. The concentration reach a peak point, and after that, the concentration slowly decreases to normal. So, what are the clinical use of cardiac markers? Number one, diagnostic use. Number two, prognostic use. And number three, risk stratification of various heart diseases like myocardial infarction and ischemic heart disease. Okay, so now the traits, the characteristics of cardiac markers. Number one, they have to be cardiospecific. Number two, they have to be highly sensitive. Number three, they have to be stable, meaning they have to be present in the bloodstream for a long time. Okay. Number four, the cardiac markers, they have to be inexpensive. Okay, to measure the cardiac markers, it shouldn't cost a lot of money, so inexpensive. Number five, easy to measure. And number six, the rate of release of the cardiac markers from the damaged cardiac cells should be directly proportional to the amount of damage of the cardiac tissue. So these are the six criteria of cardiac markers. The cardiac markers are two types. They are proteins or enzymes. Enzymes are proteins and non-enzymatic যেসব protein আছে. These are the cardiac markers. So cardiac markers, proteins, enzymes. Enzymes, what are the enzymes? Aspartate aminotransferase or serum glutamate oxaloacetate transaminase, creatine phosphokinase with subunit MB, and lactate dehydrogenase. What are the proteins? Myoglobins and myoglobin and the cardiotroponins. Cardiotroponins. The troponin are three types: troponin I, troponin T, and troponin C. Among them, troponin I is 100% cardiospecific and it is used on a regular basis. Troponin C is not 100% cardiospecific, but still it is used as a cardiac marker, whereas the troponin T is not a cardiac marker at all. It just has affinity to bind with calcium and nothing else. So I'm now discussing about the kinetic activity. So what are the cardiac markers? This is the initial rise, peak point, and return to normal. I'm talking about the concentration in the blood. So the cardiac markers are myoglobin, cardiotroponin I, cardiotroponin T, and aspartate aminotransferase, creatine phosphokinase with subunit MB, and lactate dehydrogenase. So initial rise for myoglobin, it's about 2 to 4 hours. Peak point at about 8 to 12 hours, and return to normal after 1 day. Cardiotroponin I, 4 to 6 hours initial rise. Cardiotroponin T as well as 4 to 6 hours. Cardiotroponin I peak after about 12 hours to 1 day, and return to normal after 5 to 10 days. Cardiotroponin T peak at after about 2 days, and return to normal about 10 to 15 days, after 10 to 15 days. Now aspartate aminotransferase, 6 to 8 hours, after 6 to 8 hours initial rise is seen, peak after about 1 to 2 days, and return to normal about after 3 to 4 days. CKMB, initial rise is seen after 4 to 6 hours, peak point, the concentration reaches the peak point after 1 day, and it returns to normal after 2 to 3 days. LDH, initial rise is seen after 8 to 12 hours of cardiac damage, peak point, it reaches the peak point after 2 to 3 days, and it returns to normal after 7 days. So this is all about cardiac markers. The basics about the cardiac markers, let me recapitulate. What is a cardiac marker? Intracellular proteins and enzymes that are released into the bloodstream from the due to the damage of the heart. Okay, and they show initial rise in concentration, reach a peak point, and then finally gradually decreases, and the concentration becomes normal. Now the diagnostic, prognostic, and risk stratification of heart disease. These are the clinical use of cardiac markers. What are the traits of cardiac marker? They have to be cardiospecific, highly sensitive, stable, inexpensive, easy to measure. Rate of release is directly proportional to the cardiac damage, and they have to be cardiospecific, of course. And they have to be present in very trace amount in blood in normal case. Cardiac markers are two types: proteins and enzymes. Proteins are myoglobins and troponins. Enzymes are AST, CKMB, and LDH. Kinetic activity. This is the kinetic activity. Myoglobin, initial rise 2 to 4 hours, peak 8 to 12 hours, return to normal after 1 day. Cardiotroponin I, 4 to 6 hours, 12 to 1 day, 5 to 10 days. Cardiotroponin T, initial rise 4 to 6 hours, peak 2 days, and the concentration returns to normal after 10 to 15 days. Aspartate aminotransferase or SGOT, initial rise seen after 6 to 8 hours, peak after 1 to 2 days, and return to normal after 3 to 4 days. Creatine phosphokinase subunit MB, initial rise after 4 to 6 hours, peak after 1 day, and returns to normal after 2 to 3 days. LDH, initial rise seen after 8 to 12 hours of cardiac damage, peak after 2 to 3 days, and returns to normal after a week and onwards. So this is all about cardiac markers.